Hello, in this health sketch we'd like to talk about migraine, a common kind of headache that affects around 15% of people worldwide. Women are more commonly affected than men, and they usually begin in early adulthood, but can occur at any age, including in children. But what exactly is a migraine? Migraines usually affect one side of the head and cause a throbbing or pulsing pain. Along with the headache, people also commonly experience increased sensitivity to light, noise, and smells, and may also experience nausea or vomiting. Each episode usually lasts anywhere between an hour to a few days, with symptoms typically easing after rest in a dark and quiet room. There are lots of different types of migraine, and so the symptoms are very different from person to person. These symptoms can occur in stages, although not all people experience all the stages. In the first stage, subtle changes might be experienced a day or two before the headache, such as mood changes, cravings, or yawning. In the next stage, some people will experience auras. These are temporary changes to vision or odd sensations that occur just before or during the headache. This is followed by the main headache stage, which we've already described, and lastly, a recovery stage, where people often still feel tired. The cause of migraines is not yet well understood, though we think it has something to do with the blood vessels, nerves, and chemicals in the brain. Genetics might have a role, since migraines can run in families. For people who suffer from migraines, certain triggers can lead episodes to occur. These include stress and exertion, lack of sleep, particular foods and drinks, skipping meals, weather changes, hormonal changes, and environments with bright lights, noise, or smell. These triggers will vary from person to person. Apart from migraines, there are many other causes of headache, and some can be serious, so it is important to see a doctor to get a diagnosis. There is no specific test for diagnosing migraine, so doctors will ask about your symptoms. To aid in the diagnosis, it might help to keep a headache diary by noting down when they happen, what you are doing at the time, how long they last, and what other symptoms you experience. So, how is migraine treated? When a migraine occurs, sleeping or lying down in a dark and quiet room can help, along with simple pain relief medication. Your doctor might suggest a group of drugs called triptans, which act on the chemicals and blood vessels in the brain. Anti-sickness medication can also be used if nausea and vomiting is a problem. If these medications are not enough to treat migraine episodes, there is other preventative medication that doctors may try to reduce the frequency and severity of episodes, although these may not always work. Another way of managing migraines is to avoid the triggers that bring it on. If you keep a diary of migraine symptoms, patterns may emerge that help you identify what triggers to avoid. And it can also help to maintain a generally healthy lifestyle, including regular sleep, exercise and meals, and limiting caffeine and alcohol intake. Living with migraines can be difficult, as they can disrupt normal daily activities and impact on work, family, and social life. But a number of treatments and strategies are available, so it is important to speak to your doctor if this is the case. Patient support groups are available to connect with others who are going through similar experiences. Over time, most people will gain a better understanding of their migraines and what works for them. In this health sketch, we've talked about migraines, a very common kind of headache. We've talked about the different symptoms and stages, the causes and triggers, and how they can be managed. We hope this health sketch is helpful to you and those around you. Health Sketch. Health for all to see.